Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to Dr. Ozello's Sports Medicine Report. Today I'm going to speak about lumbar central stenosis. The lumbar spine is the medical name for the low back. Stenosis is the narrowing of a passageway. Central stenosis is the narrowing of the spinal canal. The spinal canal is the area where the spinal cord travels through. Central stenosis should not be confused with lateral stenosis. Lateral stenosis is narrowing of the neural foramina, which is the space that the spinal nerve roots go through after they have branched off the spinal cord. So today's Dr. Ozello Sports Medicine Report is going to be on lumbar central stenosis. Lumbar central spinal stenosis is a common source of low back pain and leg pain. It is a significant cause of disability. It is a painful and frustrating condition. Central stenosis is the narrowing of the spinal canal. And again, this is not to be confused with lateral stenosis, which is the narrowing of the neural foramina, which is the space that the spinal nerve roots go through after they have branched off the spinal cord. Lumbar central spinal stenosis can be congenital or acquired. When it is acquired, the most common source is degeneration. Other sources include a combination of congenital and degenerative, spondylolisthesis or spondylolysis. There can also be a post-traumatic source or a metabolic source. An example of the metabolic source is Paget's disease. Lumbar central spinal stenosis usually occurs over the age of 60, but it can occur earlier, but it is most common after the age of 60. And there may be an associated cervical stenosis when there is lumbar central spinal stenosis. The cervical spine is the medical name for the neck. The thoracic spine is the medical name for the midback, and the lumbar spine is the medical name for the low back. So there may be an associated cervical central stenosis when there is a lumbar central stenosis. Now it is time for the disclaimer. Please remember that watching this video does not take the place of seeing a medical professional. If you have any type of condition, including lumbar spine central stenosis, please see a medical professional for evaluation, diagnosis, and treatment. Please do not self-diagnose yourself. Please see a medical professional for evaluation, diagnosis, and treatment. If you start any type of exercise program, always start at your current health, fitness, and strength levels. Do not start at what you used to be able to do. Please start any type of exercise program at your current health, fitness, and strength levels. If an exercise elicits or intensifies symptoms, you want to modify that exercise or eliminate that exercise immediately and find a viable substitute. Again, never perform an exercise that elicits or intensifies symptoms. Always perform all exercises through a symptom-free range of motion. Lumbar central spinal stenosis can cause spinal cord compression, which increases intraspinal cord pressure. This can lead to a variety of symptoms. The most common symptoms of lumbar central spinal stenosis include bilateral gluteal and bilateral posterior thigh pain, but it can also involve the entire leg. Symptoms rarely affect only a single nerve root distribution, and symptoms usually appear in a non-dermatomal distribution. There is usually an insidious onset of symptoms. The distribution in the lower extremities is dependent on the areas of stenosis. The symptoms are typically bilateral, but usually asymmetrical side to side. The symptoms improve with trunk flexion, sitting, stooping, and lying down. The symptoms are aggravated by prolonged standing and lumbar extension. Now, these last 2 points are extremely important, so I'm going to go ahead and repeat them. The symptoms of lumbar central spinal stenosis usually improve with trunk flexion, sitting, stooping, and lying down, and are usually intensified by prolonged standing and lumbar extension. The pain may be a sharp shooting shock-like pain, or it may be a deep, dull, achy pain. Weakness in the lower limbs may be present. Walking up steps is usually easier than walking down steps, since the spine is flexed slightly while walking up stairs. The pulses in the lower extremity may be weaker than normal. Altered reflexes may be present. There is a possibility of numbness, tingling, and burning sensations. One thing that you may find is that if you are starting to feel the symptoms of lumbar central spinal stenosis after walking or prolonged standing, if you bend forward slightly or stoop, the symptoms lessen. And the symptoms may also lessen if you sit down and bend forward slightly. Again, so there may be a resolution or lessening of the symptoms if you stoop forward while sitting or standing. The MRI is the diagnostic modality of choice for lumbar central spinal stenosis, as it allows for visualization of both soft tissue and neural structures. MRI will confirm the presence of anatomical narrowing of the spinal canal. As a doctor of chiropractic, lumbar central spinal stenosis is something I have seen in my office numerous times. Lumbar central spinal stenosis is a condition that causes a great deal of pain and can be very performance limiting. As a doctor of chiropractic, the primary tool that I use is what is called the chiropractic adjustment. The chiropractic adjustment helps to reestablish proper skeletal motion and to optimize nerve flow. Prevention, prevention, prevention. Prevention is easier, faster, and less expensive than injury rehabilitation. Let me say that again. Injury prevention is easier, faster, and less expensive than injury rehabilitation. There are several things that you want to do if you want to prevent this condition and if you are suffering with this condition that may help you to rehabilitate. First of all, you want to perform spine and core strengthening exercises, but you want to avoid moving into lumbar extension. Lumbar extension is bending backwards. Remember, I spoke about this before. Lumbar extension will increase the symptoms of lumbar central spinal stenosis. So you want to avoid anything where you're moving into lumbar extension. You want to stretch the lumbar spine, the gluteal muscles, and the lower extremities. You can look into a series of exercises called the Williams flexion exercises. The Williams flexion exercises are a series of exercises that I have done a video for, and I am going to post a link. These are low back stretching exercises and core strengthening exercises. You can also perform a seated lumbar stretch. I have a video on that, and also you can perform a supine knees to chest stretch. Whenever you perform any type of stretch, you always want to move into the stretch slowly and hold a mild, comfortable stretch, and then move out of the stretch slowly. When you're performing any type of exercise, if an exercise elicits or intensifies symptoms, please stop immediately. You can modify that exercise, and if that does not work, then skip that exercise and find a viable substitute. Perform all exercises through a symptom-free range of motion. You can perform strengthening exercises for the deep core muscles. These muscles include the transverse abdominis, which is the deepest core muscle, the multifidi, which is a lumbar muscle, but will also be strengthened with these two exercises that I'm going to mention, and also the internal oblique muscles. You can perform abdominal drawing in maneuver, which is often abbreviated to ADIM. This will help to strengthen the deep core muscles, and also you can perform abdominal hollowing, which is also known as stomach vacuums. Once you have mastered those two exercises, you can advance to abdominal bracing and the supine pelvic tilt. Once you have mastered abdominal bracing and the supine pelvic tilt, you can graduate to performing the dead bug exercise. Again, always remember to perform all exercises in a slow and controlled manner and work through a symptom-free range of motion. Some general nutrition strategies that you can apply that may help. First of all, look into anti-inflammatory foods. You want to improve your gut health. You want to eat lean proteins, and you want to increase your intake of omega-3 fatty acids, and you want to eat healthy fats. Eat your fruits and vegetables. Your plate should be very colorful, and you want to eat a wide variety of healthy foods. Chew your food very well. This helps with digestion and helps with gut health. Also, hydration. Please stay hydrated. It doesn't matter what time of year it is, you need to stay hydrated. Supplementation should be from certified organic whole foods. If you are overweight, lose weight. Combine nutrition with exercise to help you to lose weight. Vitamin D is vital for our health. You can get a safe level of sun exposure by being in the sun during non-peak hours for even 10 or 15 minutes a day. And you also want to have vitamin D dietary sources and supplementation. And you want to increase your vitamin K intake. Vitamin K occurs in green leafy vegetables. You can work with a doctor of chiropractic like myself, or you can work with a registered dietitian to help you to develop or formulate nutritional strategies that work for your individual needs. You always want to set up a nutritional plan that works for your individual needs at your current health, fitness, and strength levels. Thank you, everybody, for watching today's episode of Dr. Ozello Sports Medicine Report, where I went over lumbar central spinal stenosis. Again, please see a medical professional for evaluation, diagnosis, and treatment. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can find additional information on the book, and you can also find my blog. My blog contains articles on chiropractic care, spine health, sports medicine, exercise, fitness, and nutrition. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comments section below. Please subscribe to my YouTube page, and always remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Prevent injuries with smart training, and rehabilitate your injuries completely. This will help you to accomplish your goals.